Hello guys, welcome to my new channel. The Less is More. So today I will discuss an editorial from Indian Express. So today the topic is health sector and health institution or health system in India. So let's start the editorial itself. The title of the editorial is Making India Pandemic Proof. Approach that recognizes link between human health and ecosystem is critical. So approach is critical that recognize link between human health and ecosystem. As COVID-19 abates, the question everyone is asking is how ready is the country for the next pandemic? The virus spread exposed the weakness in the world health system, including those of countries ranked high in the Global Health Security Index. So, as the COVID-19 abates, the question everyone is asking that how ready is the country for the next pandemic? Because this spreading of COVID-19 has exposed the weakness of health sector in developed and developing countries, right? So, COVID has also created a chance to build stronger health system. Climate change is giving rise to new pathogens and zoonotic disease are spilling over from animals to humans, causing over 1 million deaths each year. So guys, be attentive to this session, because today in this editorial, uh, on each line there is a new way forward, and there is a new example of how health institution and health infrastructure helped us in COVID-19 and to India and other countries, so that we can use these kind of examples and new approaches in writing the mains answer. Okay, so it's a very good editorial, so you should have a screenshot of this editorial, because every line indicates something new, right? So be attentive. So COVID-19 has given us chance to build stronger health system. Even climate change is giving rise to what? New pathogens and zoonotic diseases spilling over from animals to humans. A silent pandemic is also lurking. What? Antibiotic resistance. So due to climate change, new pathogens are emerging, zoonotic disease are emerging, then antibiotic resistance is emerging. The world realizes that the cost of preventing pandemic is far lower. So preventing pandemic is far lower than cost of managing. Right now, the need of the hour is a holistic One Health approach that addresses the health of people, animal, and whole ecosystem. India is one of the world's first countries to frame a game plan in this regard. See, you can write this in answer that India is the world's first country to frame a game plan in this regard. That means One Health approach. In October 2021, India launched its flagship program to prevent, prepare, and respond to pandemics. Since one of the key weaknesses during the COVID crisis was the inadequacy of institutions and systems, right? So weakness is what? Inadequacy of institution and system. The program, the Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, PM ABHIM, Ayushman Bharat Health Infrastructure Mission, seeks to fill the gaps at both national and state level. It will need to be overseen at the highest level. So this inadequacy of institution and system, these gap would be fulfilled by the new Pradhan Mantri Ayushman Bharat Health Institution Mission, Health Infrastructure Mission. Okay, at national and state level. India has also brought several ministries including health, animal husbandry, forest, and biotechnology under the principal scientific advisors. Why these? The first, health is human health, animal husbandry related to animal health, forest due to climate change, and biotechnology due to pathogens. This was one of the major shortcomings during the pandemic, that all the ministries or the related ministries are not in coordination with each other. In most countries, the COVID response was hampered by overlapping mandates and weak coordination between key institutions. So here what I have marked in red is the reasons of failure, right, or shortcomings, and in the green, with the green pen I have marked the positive steps that were taken during the pandemic or that will be taken. More recently, the foundation for the National Institutes for One Health in Nagpur was laid. In Nagpur, National Institute for One Health. The institute will identify hotspots for endemic and emerging zoonotic diseases to contain their spread early on. So this institute will identify hotspots for endemic and emerging zoonotic disease, for endemic and emerging zoonotic diseases to contain their spread early. Its success will depend on how well these strategies are implemented on the ground. The fact that 30 cities accounted for almost 80% of India's reported COVID cases shows how vulnerable urban populations are to the spread of disease. So there is the fact that 30 cities of India accounted for most of the 80% of the reported cases. Guys, this is a huge or a very concern fact that only 30 major cities are accounted for 80% of India's reported COVID cases, and it shows what how vulnerable urban populations are. India is now augmenting surveillance in 20 cities, right? Augmenting surveillance, both large and small, with municipal corporation being mandated to identify the most vulnerable areas and provide early alerts. For this to be successful, private hospitals and clinics, which provide over 60% of India's healthcare, for to make this successful, private hospital and clinics, which make what 60% of health infrastructure, will need to be brought under a common platform and data placed in the public domain. So these private hospital and clinics need to be brought under common platform and data placed in the public domain. The Ayushman Bharat Digital Health Mission can facilitate this. So Ayushman Bharat Digital Health Mission, earlier Ayushman Bharat Health Infrastructure Mission, this is Digital Health Mission, so it will provide digital solutions, right, to healthcare system. In villages where people and livestock live in proximity, the risk of cross infection is greater. Here, strong partnership will be needed with whom? Communities, dairy cooperatives, and poultry industries to identify new infections, right? Whom? Communities, animal husbandry, for that dairy cooperatives and poultry industry. The rise of new pathogens has highlighted the importance of genomic surveillance. During the pandemic, India was able to create in a short time a formidable network of institutions that can identify what? New pathogens. Formidable network of institutions for genomic surveillance. This can now be complemented with wider testing of wastewater and samples from incoming ships and aircraft. This surveillance system will also need to be extended to other South Asian countries. So this surveillance system will also need to be extended to other South Asian countries, as no country is safe unless its neighbors are safe. So these surveillance system need to be extended to South Asian countries, because no country is safe unless its neighbors are safe. India is also expanding its network of research laboratories. India is what doing? Expanding network of research laboratories which primarily focused on influenza to cover all respiratory viruses of unknown origin. Network of research laboratory to primarily focus on influenza which cover what? All respiratory viruses of unknown origin. Antibiotic resistance will have to be tracked and powerful awareness campaigns are needed to promote their rational use. Antibiotic resistance will have to be tracked and powerful awareness campaigns are needed to promote their rational use. So tracking and awareness campaign. After the 2015 MERS outbreak, South Korea used mobile technology and big data to trace contacts and build a strong capacity for diagnosis. But South Korea has used mobile technology and big data to trace contacts and build a strong capacity. The government also started semi-annual training sessions that simulated the spread of viral disease. India has also begun these exercises. So India has begun this exercise of semi-annual training sessions. During the pandemic, Indian manufacturers produced vaccines, test kits. So during pandemic, Indian manufacturers produce vaccines, test kits, therapeutics, mask, and other items at very competitive price for both India and other countries. The partnership between research bodies and manufacturers will need to be sustained and enhanced to make India a global hub in the biopharma sector. Partnership between research bodies and manufacturers. The clinical trial network set up under the National Biopharma Mission. This is again a government initiative, National Biopharma Mission. Clinical trial network set up under this is a positive step toward improving access to affordable new vaccines and drugs in India and around the world. Similarly, the ICMR's initiative to establish a biorepository for clinical samples will be a national and global asset. Similarly, ICMR's initiative to establish biorepository for clinical samples. Biorepository for clinical samples will be national and global asset. The World Bank has recently augmented its support to the country's health sector. World Bank has augmented its support to country's health sector $3.5 billion. We are working with PM Abhim to build institution and system for preventing and responding to future pandemics. Preventing and responding to future pandemics through Abhim institution. We are also helping improve the provision of primary health care by supporting the Ayushman Bharat Health and Wellness Centers under the National Health Mission at the center and in 7 states. So, institutions are being made and primary health care. Provision for primary health care is improving at Ayushman Bharat and Ayushman Bharat Health and Wellness Center. Okay, under National Health Mission. Then there is Ayushman Bharat Digital Health Mission, Ayushman Bharat Health Infrastructure Mission, and National Health Mission. The success of India's effort will be critical, for it is no longer a matter of if there is another pandemic, but when? So this is a good conclusion, guys, that can be used for any kind of essay. The success of India's effort will be critical, for it is no longer a matter of if there is another pandemic, but when there is another pandemic, we are ready. So it's a no longer matter of if there is another chance, but when there is another chance. This kind of conclusion, this can be used in essay, right, on education or science and technology, or any kind of philosophical essay. You can use this conclusion, guys. Okay, so this was for today, guys, making India pandemic proof. This editorial has given us various government initiative, and how India how India has fought to COVID-19 crisis. Okay, and what are the steps that are being taken by the government to again making India a pandemic proof. Okay, guys, thank you so much. Bye bye. Signing off for the day.